So today I'm going to be treating frozen shoulder, non-specific anterior joint capsulitis, or whatever term you want to use for it, using the Tecar. I've gone into frozen shoulder here. You'll see we've got 5 minutes, starting off at level 9. Level 9's probably quite high for this. It need turning down during the treatment. We could preload and go to level 10, but I'm not going to. I'm going to stay at level 9. Let's see this from the perspective of the treatment. So I'll just bring the thermal camera in here and we'll have a look and see what the thermal camera says. Just wait for it to focus. We're in the 31s, 31.34, fairly normal for the front of the shoulder. I'm going to be handing the patient the earthing electrode. This is fairly common if you're doing the upper limb. It's just easy to do that. We'll apply some contact medium to the electrode here. I'll spread that contact medium out and hand it to the patient. There's not a convenient point to put the electrode really for this treatment. We'll apply some contact medium to the front of the shoulder. Most frozen shoulder problems are at the front of the shoulder, and so we're going to be using the Tecar to warm up the front of the shoulder. This is done very frequently before you do mobilisations of the shoulder, and move around in small circles until the patient feels the heat build up, and then turn the machine down. Because we started at level 9, it's very likely the machine will need to be turned down. The more inflamed the shoulder is, the more likely it is it will need to be turned down. If you're turning it down, make sure you've got your finger on the minus button if you're new to using the machine, or pause the treatment, or lift the head off the patient and just press down. If you stop, and that's a common thing people do when they're new to doing treatments with Tecar, they'll go to turn the treatment down and actually stop still, and the patient will then pull away. If the patient's laying on a bed, they can't pull away really for the shoulder, so not at the front at least. Do bear that in mind. It is a common thing to stop while you press the down button when you're first new to it. Hover your finger over the down button, and then if you need to turn the machine down, it's fairly easy to do. Just keep it moving as you do it. You'll see the heat start to build into the tissues. You'll actually see the skin redden. You see some flushing in the skin erythema. That's fairly common. It actually comes from the redox principle in the tissues. So we'll keep moving here. Keep building up the heat. You may get a hot spot, especially if you're going, over towards the scapula, as I am up here over the acromial process. You might find that gets warm, and it's perfectly fine to turn the machine down or just start avoiding that spot. You can physically see the skin starting to go red. It's starting to heat up now. So fairly easy to spot. If your patient says they can't feel any heat, it's perfectly fine to take the machine off, temporarily pause the treatment and put the head on your own arm, and you'll feel that the head is hot. So you see the redness there in the skin. I'll bring the thermal camera back in here, and you'll see, just like any treatment at the front of the shoulder, we're up into the high 38 degrees. So that's a significant increase in temperature. The front of the shoulder heats up really nicely. I'll just wait for this to focus. It may focus in at some point. It is a bit of a problem with modern cameras. And there we go. Good treatment to the front of the shoulder, used a lot pre-mobilisation in frozen shoulders.